In a groundbreaking revelation that could reshape global health recommendations, medical professionals have identified a medication that surpasses aspirin in its ability to prevent heart attacks and strokes. This discovery is particularly significant, given that for many years, millions have been advised to take low-dose aspirin daily to mitigate their risk of serious cardiovascular incidents. Aspirin works by making the blood less viscous, thereby helping to avert heart attacks and strokes. However, a recent study unveiled at the largest heart conference in the world has shown that clopidogrel, a widely used blood thinner, is not only more effective but also does not carry additional risks. This remarkable finding was shared at the European Society of Cardiology Congress held in Madrid, with the detailed results published simultaneously in the prestigious medical journal, The Lancet. An international team of researchers from countries such as the United States, the United Kingdom, Australia, Switzerland, and Japan conducted this study. They concluded that clopidogrel is superior to aspirin and advocated for its widespread adoption in clinical practices around the globe. Their thorough analysis involved nearly 29,000 patients suffering from coronary artery disease, CAD, revealing that clopidogrel outperformed aspirin in preventing severe heart and stroke-related events, all while maintaining a similar risk profile for major bleeding incidents. Coronary artery disease is the most prevalent type of heart disease and a leading cause of mortality and disability worldwide, affecting over 300 million individuals, including approximately 2.3 million in the UK alone. This condition arises when the arteries supplying blood to the heart become narrowed due to the accumulation of atheroma, a fatty substance. The discomfort or pain resulting from this narrowing is known as angina, and a complete blockage can lead to a heart attack. These findings challenge the long-standing guideline that recommends aspirin as the primary treatment for preventing serious cardiovascular events in the vast population of CAD patients. Traditionally, aspirin has been prescribed indefinitely to these individuals to help prevent heart attacks, strokes, and cardiovascular-related deaths. Yet, crucially, the incidence of major bleeding complications was found to be comparable between the two medications, alleviating concerns that clopidogrel might lead to an increased risk of bleeding. In their article published in The Lancet, the research team stated, "This comprehensive synthesis of available evidence indicates that in patients with CAD, long-term clopidogrel monotherapy offers superior protection against major cardiovascular and cerebrovascular events compared with aspirin without an excess risk of bleeding." They further noted that the enhanced effectiveness of clopidogrel over aspirin was consistent across various key subgroups, including those with clinical characteristics that might predict a poor response to clopidogrel, thereby supporting the applicability of these findings to a wide range of CAD patients. The results advocate for a preference for clopidogrel over aspirin as the chronic antiplatelet therapy for individuals with stable CAD. The fact that clopidogrel is widely available, comes in a generic form, and is affordable further bolsters its potential for broad adoption in clinical settings. The analysis included diverse patient populations, including those who had undergone procedures like stent placements or had experienced acute coronary syndrome, ensuring that the findings are relevant across different groups. Interestingly, even patients who might be genetically or clinically predisposed to respond poorly to clopidogrel still showed benefits from its use compared to aspirin. This suggests that clopidogrel should be regarded as the preferred long-term antiplatelet medication for those with CAD. Given that both medications are readily accessible, these findings could significantly influence clinical guidelines worldwide and enhance patient outcomes. However, further research into the cost-effectiveness of clopidogrel, along with broader population studies, will be essential to support any changes in treatment protocols. Professor Brian Williams, the Chief Scientific and Medical Officer at the British Heart Foundation, remarked, "Aspirin is a commonly prescribed medication aimed at preventing subsequent heart attacks and strokes. This research indicates that clopidogrel, as an alternative to aspirin, may be more effective in preventing recurrent heart attacks or strokes. Importantly, these advantages come without an increased risk of major bleeding. These findings are likely to influence the medications that doctors prescribe to their patients to lower their risk of future heart issues." But here's where it gets controversial. Will this new evidence lead to a complete overhaul of existing treatment guidelines, or will the medical community be slow to adapt? What do you think? Should clopidogrel replace aspirin as the go-to medication for preventing heart attacks and strokes? Share your thoughts in the comments.